This financial year, the health sector was allocated 2.9 trillion shillings, which is expected to improve the health of Ugandans. Priority will be put on construction, rehabilitation, and equipping of dilapidated hospitals, among others. However, this is a drop from last year's 4 trillion shillings, which the Uganda Medical Association says is a significant cut and will have a negative impact on service delivery.
Now there have been many instances in our health facilities whereby the ambulance is available, but there is no fuel. And the health workers are forced to start mobilizing money for fuel from the patients. But some of the Ugandans are very poor. They come to these government facilities because they cannot afford private health care. And when they're in a very sore state, at their worst, and then you start telling them that you want them to mobilize money for fuel, usually they don't have this money, and they have to start making phone calls. Now, this one contributes to delays.
The medical workers are also worried about what they called potential loss of funding for critical healthcare projects, an issue that was also recently raised when MPs were debating the Appropriation Bill 2024.
And these ones include the 26 billion shillings, which was allocated by the Budget Committee and the Health Committee of Parliament, which was meant for ongoing construction of health centers, including health center 4s, which are being upgraded. 26 billion shillings for additional ambulance procurement.
Invest it in Uganda, but it is funny that it is us who now give investors money. If that money should be given to health workers to go and establish small units in rural areas, that would be one creating employment for the doctors, nurses, and all other cadres, but at the same time making services accessible.
Uganda is signatory to the Abuja Declaration, where African Union members committed to locally fund their health budgets by up to 15%, a pledge Uganda has not achieved in decades.